maybe not. To answer that question and to delve into that, we have Bob Gann, who is Programme Director for Widening Digital Participation at NHS England. I've been doing this too long. NHS England. Bob.
Thank you very much. And ripple of applause before I've even started. Thank you so much for staying to the bitter end. It's always, when you see that your slot is almost the last session of a 3-day or 2-day event, it's a worrying slot. So thank you so much for sticking with us. So I work for NHS England, and my role there is to look at how we can combat the growing risk of digital inequality, and particularly how we ensure that digital innovations mean we don't leave people behind, and how we can widen the reach of digital innovations. So I've actually slightly tweaked the title of the talk, because I think although mHealth, mobile health, is undoubtedly the area with the greatest potential where things are going to be happening, I prefer to look at a slightly broader connected health or digital health agenda, if you like. And secondly, the question of does mHealth work, I think has a very short answer, and that is that we don't know. And if that was all I had to say, that would be quite a short presentation. So I think it's more about, can it work? What are the barriers to it working, and how we might be able to overcome some of those. So last year there was a report from Pew Research, so a respected US research organisation who do quite a bit around digital health. And what they said was that in 10 years the internet will be totally ubiquitous. Connected technologies will be totally ubiquitous. And we've heard many, many examples of those enormously exciting innovations over the course of the conference, and will be embedded in people's lives for good or ill. And excitingly, for people working in my area, Pew felt that the greatest impact of that fantastic revolution would be on digital health, and that healthcare, they say, will become self-administered. So it will be using technologies to detect, monitor, diagnose, using mobile, using wearables, using implanted devices. But with that fantastically exciting revolution comes a challenge. And that challenge is that we risk an increasing divide, and that we create a digitally engaged population who are making the use of all those technologies, and we have a left behind population, the population who most need healthcare actually, who are not in touch with those developments. Just 2 or 3 weeks ago actually, with very good timing as I started to think about this presentation, the very respected again UK health policy think tank, the King's Fund Centre, produced a report on the digital revolution, and I do recommend that you check that out. It's a really accessible and nice summary of the kind of digital revolution that we are engaging with nowadays. And they suggested 8 technologies that are going to transform healthcare. So a technology for transformation around smartphones. So hardly a new technology, but a technology whose enormous potential is not yet fully realised. Both the potential for individuals, but also the potential for enormous data gathering and mass analysis and research. Secondly, at-home diagnostics. Now, I've worked in the NHS quite a long time, and I remember the days when medical technology was so massive, so expensive, so cumbersome, it couldn't possibly ever go outside hospital walls. We now have technologies that are so portable, so comparatively cheap, that they can be in the home of anyone who needs one. An enormous potential for monitoring, for long-term conditions, for assistive technology for people with disabilities. Thirdly, smart drug delivery. Around half of all medicines aren't taken properly, and we're beginning to see technologies now where implanted devices actually in medicines, in pills. So your doctor knows whether you've taken those pills and whether you've taken them at the right time. Digital therapeutics, actually quite a well-established and well-developed intervention. So in areas like psychological therapies, online cognitive behaviour therapy, really well established and with very good evidence of effectiveness. Lifestyle management, weight management programs, all those kinds of treatments and interventions delivered in digital space. Genome sequencing, really exciting development for personal gene profiling to help people understand their own health risk, but also, again, a big data application. Initiatives like the 100,000 Genome Project in the NHS, which is mapping big population-level genome intelligence. Machine learning and big data. We've struggled in the NHS to make sense of massive, messy data sources. So artificial intelligence is helping us to understand those things better. And I've worked with things like social media to help us understand public health challenges. So social media are incredibly powerful source of big data, but a real bastard to analyse. So those kinds of developments. Blockchain. The report suggests, and a number of commentators are thinking this, that the technology behind Bitcoin, because it's distributed, because it's encrypted, because it isn't owned by anybody, could be very significant in patient-held records in future, and could actually be a very resilient way of patients holding their own record and sharing that with professionals. And then finally, connecting communities. Again, pretty well established, but connecting digitally with people experiencing the same condition as yourself, and maybe contributing your experiences to help others like you, but also to help medical research initiatives like patients like me. I just was thinking about all the kind of wearable technologies we now take for granted around health. I, as many people do, wear a Fitbit. Many of us do that. It's mainly at the moment around measuring my healthy lifestyle, but it could be used increasingly, technologies like that, to monitor people's long-term conditions if they have them. Baby, we've heard loads about, even the talks I've sat in on today, loads of things about how we kind of monitor in our homes, washable, wearable baby monitors, temporary tattoos, mentioned digital pills already, all those kinds of technologies. So why aren't they taking off? Perhaps as much as they should. They are taking off, but they could be even more. And some of the barriers to adoption. Firstly, I think we've got real concerns about data security. I've heard a lot about that today in other applications. And data security is really sensitive in health. You'll of course understand that. Our own health status is one of the most sensitive things in our lives. And people are concerned that the data about you that's gathered through connected technologies may not be safely handled. And I heard in the previous session here some of those concerns about security, the dark side of wearables, how they're jeopardising your security and privacy. Secondly, we have a really uncertain regulatory environment. Whether an app or a digital health device is a medical device, and whether that needs regulating by the Medical and Health Products Regulatory Authority, whether it needs regulating by the FDA in America, by the European Commission, So that's really uncertain, that environment, and that's quite a barrier to innovation. Thirdly, limited connectivity. I've seen loads and loads of great examples of apps and tools, but they're developed in silos. They don't enable that to connect with your health record, and any device that's going to be really, really useful has to be able to do that increasingly going forward. We lack good evidence on benefits. Study I was reading just before Christmas, Scripps Wide for Health study, no clinical or economic benefit from digital health monitoring. There are benefits, but those have been very difficult to prove, and we need a lot more evidence around that. Someone in a panel I heard earlier on said it's not about technology, it's about hearts and minds, and I think that is really, really crucial. We have quite an entrenched workforce in the NHS, and people in the NHS are not yet open to the idea of digital and the potential for that. In fact, they may even be nervous and hostile. It may impact on their work, it may mean they're not needed anymore. So overcoming some of those attitudes is a really entrenched challenge. And then we've got just some simple infrastructure challenges. You know, if you're delivering remote healthcare into a rural environment which has really poor broadband coverage, you've just got some real simple infrastructure constraints there. And then finally, we have a really big challenge about digital exclusion, an area that I've worked a lot on over the past couple of years, and I'll just focus on that a little bit as well now. So, somebody said to me a little while ago, it's not about the internet, it's about the internet. It's about the people who aren't connected in our society. And in the UK, we've got a massive digital divide in the UK. We still have 6 million people in the UK who have never been near any digital technology. They've never used the internet, and that includes they've never used it on a mobile device, never used it on a connected television. So it's a world they do not engage with at all, and never have, and possibly never will. We also have an even bigger population who lack basic digital skills. So they might have maybe occasionally dabbled with going online, but they're not realising its full potential. They're not really using online services at all, let alone digital health services, to their full potential. And that's not just a problem in the UK, clearly, it's a worldwide challenge. And why aren't they doing that? And why haven't they got those skills? It's not because they're stupid. I mean, digital technology is actually not that difficult to use nowadays. They haven't got those skills because they haven't got the motivation. They've never really seen a need and seen where that can add value into their lives, so they've never made the effort to get online. So I think our really big challenge increasingly isn't a simple one about a skills deficit. It's about hearts and minds, and it's about motivation, and it's about delivering services that are meaningful to people. So I've been working over the past quarter with Martha Lane Fox to develop a set of recommendations for accelerating and widening digital take-up in the NHS, particularly focusing on those audiences who perhaps otherwise we're going to miss. And Martha produced her recommendations just before Christmas. They were fairly widely reported in the media and in social media. And essentially her recommendations were 3 things. And I think actually the recommendations are slightly more nuanced than they might look on that slide. Those are kind of the headlines, but I think there's some more nuanced thinking than perhaps those simple headlines suggest. Martha's first recommendation is that we need free public Wi-Fi throughout the NHS by 2020. And some people might say, well, you know, and some people have said to me today actually, is that any kind of priority? And by 2020 might Wi-Fi be old hat? Might we see a kind of converged Wi-Fi, 3G, 4G solution? Is that really what it should be? But I think what Martha's saying here, what is behind that recommendation is, firstly, we in the NHS need to put our own house in order. If I can go into any coffee shop and I can be connected, but when I'm in hospital and I most want to be in touch with my relatives, with my friends, with my outside world, with entertainment, with running my business, it's highly unlikely that I can get online and I can do that, except possibly by some rather expensive bedside television service. So she's saying, NHS, you need to put your own house in order. And secondly, I think this isn't just about Wi-Fi, this is about creating a fully networked, connected environment within the NHS that is a platform for access and innovation. Secondly, she talks about exclusion, about prioritising reaching the furthest first. So I think what that's about is not just about inclusion and skills, it's about developing digital products that are simple, elegant, exciting for everybody to use. And if they're attractive and engaging for less digitally sophisticated users, they'll be good for everybody. And then her final recommendation is that we need to enable health workers to engage patients with digital. Because at the moment, another quite major digital gap is between highly engaged and digitally literate patients and staff who are not terribly digital, not terribly engaged, and not terribly digitally enthusiastic. In the NHS, we have been driving very hard on a simple, very, very simple thing. Online appointment bookings. Now we book appointments for things online in all kinds of areas of our lives, yet in the NHS we expect you to try and get through on the telephone at 8 in the morning to a busy GP practice and make an appointment. What an antiquated notion that is. And one of our barriers is that there are working practices and people who have got used to the fact that you phone for an appointment. And if you're a receptionist, you're a kind of custodian to that asset of a GP appointment. And breaking down some of those attitudes that why don't you recommend patients to get online, why don't you use patients to get online, maybe one of our biggest barriers we need to overcome. So Martha's recommendations are about creating a fully connected environment in the NHS, developing simple, elegant products with really good user experience for everybody, and tackling some of the entrenched attitudes in our own organisations that have prevented digital adoption. We've been doing a piece of work over the past 3 years or so to try and support and help people get online, often for the first time. So we've given them environments in places like public libraries, GP practices, homeless shelters, pubs, chip shops. We have actually done a project in a chip shop, and I think the kind of public health challenge of, saying we'll give you a place where you can use an iPad and get online for the first time and start booking your GP appointments, for example, but you're going to come into a chip shop to do it. There's an interesting kind of public health trade-off there. We've worked with about 300,000 people who've never been online in their lives before, and beginning to see some evidence. So this question about whether mHealth works, I mean, it can work. These are quite simple interventions, actually. They're things like appointment bookings or signing up for online cognitive behaviour therapies rather than some of the more sophisticated connected technology, IoT developments we've heard today. But some quite good findings. People saying they've really increased their confidence that they are more self-reliant, so they're using digital tools for minor ailments and not going to see their GP. They're using online exercise programs or weight management programs. So just shows, even with the most hard-to-reach audiences, there's real potential there. So just to finish, what might we be able to do in the NHS to help with some of the adoption and acceleration of connected health interventions? Well, firstly, providing an environment where things that aren't necessarily medical devices that have to go through the whole MHRA regulation, but would still benefit from some kind of curation and accreditation, to have a badge that says this is an NHS endorsed high quality product. And we experimented a couple of years ago with a health apps library, which actually didn't take off that well, and we're now having a new program of work that's developing a program for accreditation for things like data security and clinical accuracy, and a platform to curate and promote those. And we've done the first bit of work with mental health digital products and services. Secondly, we really do need to build evidence of effectiveness and benefits. So through the National Institute for Health Research, we're looking at funding programs of research and clinical trials that demonstrate the benefits of digital health products. We also need to encourage productive partnership building. So initiatives like our Academic Health Sciences Network, we've got 15 of those around the country, where usually led by medical schools and universities, but bringing together consumer digital industries with the NHS and with academia to develop innovation and support adoption. We also are very keen, where we can, to support local innovation. At the Davos Summit a couple of weeks ago, we announced 7 new digital test beds in the NHS. So one that I'm involved in up in Lancashire and Cumbria. So the NHS working with Philips as the major technology partner, but also a number of smaller digital health organisations and some SMEs and patient organisations developing digital innovations to keep frail elderly people out of hospital. And we're going to be having further rounds of those NHS test beds. And then finally, we need to tackle digital exclusion as a priority. We need to make sure that 12 million people who currently have no digital access or no motivation to get online are given support and given really engaging products, so the people who most need digital interventions are not left behind. Thank you very much.